coronavirus has brought the world to its knees, bringing sorrows and sufferings to the people. Especially when it has cancelled our birthday parties and all our plans for the vacation. The world is fighting its way through the virus, and Kerala has emerged as a role model to the world. So let's have a quick look on how Kerala is on the brink of success. Three billion people struggle to cope with the COVID-19 pandemic. One of the country's 28 states stands head and shoulders above the rest. Kerala, in southwestern India, has been so successful in flattening the curve that many now speak admiringly of a Kerala model for handling public health emergencies. With a population of 3.48 crore, Kerala has managed to contain the cases and limit the death toll to just 6. Kerala's fight against COVID can be divided into 3 phases. Let's study each phase and on how Kerala responded to each situation. Phase 1. Imported cases.
The first cases reported in Kerala were from the people who came from other hotspot countries. Since issuing its initial COVID-19 alert on January 18, the state has screened all arrivals at its 4 international airports and immediately hospitalized or quarantined suspected cases. Kerala was the first Indian state to report a case of COVID-19, a medical student who had arrived from Wuhan, China at the end of January. On February 4, Kerala declared COVID-19 a state-level disaster, and shut schools, restricted public gatherings, and instituted lockdowns in early March. By the time the central government had followed suit weeks later, Kerala had already deployed more than 30,000 health workers and placed tens of thousands of people in quarantine. When Indian Prime Minister Narendra Modi announced a nationwide lockdown on March 24, Kerala had the most cases of any state.
Phase 2. Community transmission.
During the first part of Phase 2, people who came in contact with the diseased were infected. The number of cases now started increasing in great numbers. The state government introduced new protocols, and a large force of police officers were made to ensure these protocols were followed. Even though in a few cases the origin wasn't found, the health department worked tirelessly to trace the origin and made route maps for each positive case. The health department also launched an awareness campaign known as Break the Chain, and prepared hundreds of quarantine rooms. With the support from all the 4 sectors, Kerala today ranks low on the list of confirmed cases, and high on the list of COVID-19 recoveries. Moreover, the state's fatality rate, 0.53%, is the lowest in India, and it has managed to limit the spread of the virus without inflicting any of the human suffering seen in other parts of the country.
Phase 3. Bringing back of Keralites.
As part of the new mission launched, Kerala started bringing fellow Keralites who were stranded in the hotspot regions of different countries and states. Screenings were done in airports, and those who showed symptoms were moved into institutional quarantine. Others were strictly ordered to go to home quarantine, and the health department regularly inquired about them. Kerala also became a role model in implementing home quarantine successfully. Even though the cases are increasing day by day, it is in a controlled manner. The cases due to community transmission is relatively low. As the first phase of Unlock India has begun, shops are opened and public transport restarted. And thus we cannot completely remove community transmission off the table. We, as the citizens of the world, are obliged to follow the protocols, keep a good hygiene, and to stop spreading fake news. It is only with our help can the world overcome this pandemic.